So we're here today with Dr. Nance MacLeod, and today we're going to be talking about something that I'm not too familiar with, so I've got some questions for you, but electrotherapy to treat pain in ourselves, something you specialize in. How do you, how do you categorize electrotherapy? What do you use to do it?
Well, mostly what I'm using is a device called a SCENAR, and that stands for Self-Controlled Electronic Neural Adapter Regulator. I know that's a mouthful.
A mouthful, yeah, absolutely.
And basically it was invented, this is one of the first ones, the 97.4. It was invented by the Russian cosmonauts.
Oh, okay.
And about 30 years ago. This is my oldest one. I still use it a lot, so they last a long time, obviously.
Yeah.
Because I use this in my practice. It's just an amazing device as far as sending in electronic impulses, and it communicates with the body on an electronic level. And by communicating with the body, it tells the body this is where you need to send neurotransmitters and whatever to get rid of this pain.
Okay.
So people who've had pain for 50 years have actually found relief. I won't say I've gotten rid of 100% of their pain.
But some relief.
But I've gotten rid of 50 or 70 or 80% of their pain in some cases.
Yeah.
And people who just injure themselves, like in sports injuries, they will just come to see me right away as soon as they've injured themselves. And if they're in with 24 hours, I usually can eliminate that pain.
So you can use this on a patient or a client to speed up the process, the healing process.
Absolutely. You can use it pre and post-op. So if they're about to go into an operation to a replacement hip, a replacement knee, if they come and see me first, I can help them have their operation be more successful.
And you've got two other similar machines here. Talk to me about the other two that we have here.
Well, these two are newer devices. There's a lot of SCENARs out there. If you Google SCENAR, you're going to get a lot of information. But you have to be careful about which ones are Health Canada approved, number one, and which ones actually really work. This is the Health Canada approved SCENAR. This is the latest one.
Okay. It's I think I just turned it on.
Yep, you did. AccuScan Pro Plus that has 5 different modes, so there's a number of different things I can do with this.
So how would you use it? Like, just give me an example. How would you?
Well, basically, I would be using it mostly on your spine, but if you have an injured arm, for example, I'd be using
you're just waving it over the affected area?
I'm just putting it over affected area. I make sure I bring it up until you feel it.
I'm starting to feel it there. So just a little tingling sensation.
Yeah, you don't want to be in pain. I don't want you to be jumping through the ceiling or anything.
No, you're trying to alleviate my pain.
I'm trying to alleviate your pain. Yeah, and it actually will just by doing that, if there's certain areas it'll stick. For example, you might have a sore neck or something. Right. It will stick in that area.
Excellent.
And then I can't move it, and it'll stay there until the dosage is done, type of thing.
It seems pretty straightforward. Nance, if people want to get in touch with you, how do they do it?
They can go on my website, www.thewellnessdiva.org, or they can call 289-669-0015.
Excellent. Well, we've got more coming up on Hamilton Life for health and wellness, for your health and wellness, so stay tuned. We will see you next time. This is kind of neat.
Yeah.